Good morning. Today we're going to be talking about colorectal cancer awareness because March is the month for promoting the awareness on colorectal cancers. Thank you, Dr. Ajay, for coming on the program. It is a pleasure to have you here.
The pleasure is mine. Thank you for having me. Good morning, everyone.
So we are talking about colorectal cancer, and I'd like you to just tell us, why is it so important to talk about colorectal cancer? Why is there a whole month, the whole month of March, created for the awareness of colorectal cancer? What is it?
Okay, so colorectal cancer is one of the cancers of the gastrointestinal tract, and it happens to be the most common of the gastrointestinal tract. Colorectal itself, it's a combined term from the colon and the rectum. These are parts of the longest tract of the digestive system. And you would agree with me, it's about being the longest tract. There's a lot of events, both normal and paranormal events that could happen along this tract. The reason why we're discussing this, and I think that's the public health importance of this, is from the records, 2020 Global findings places colorectal cancers second to prostate cancers in men, and places the same cancer we're discussing about the fifth most common in women. Now, the mortality and the morbidity associated with the disease and the long burden on and the weight of the care on the carers and even on the patients makes this disease very important, and what we can discuss and look forward to how we can prevent it. Interestingly, there are ways in which we could screen, and there are ways in which we could monitor. Individuals can monitor themselves so that they can preempt this disease. So it's not something that like the prostate cancer, like cervical cancer, a lot of light is being beamed on it so that we could prevent the disease and prevent death from the disease.
Thank you. That's very important. Now, a question I like to ask is, colorectal cancer, for some reason, I feel there's an epidemic of it. I'll tell you why. When I was a medical student, and by the way, I was a very good medical student, I'm not one of those skivers, I can hardly recall a case. I know that was a long, long time ago, but now it is so rampant. It is everywhere. Why?
Now, there's as globalization occurs and increases, there's been that tendency, and we're beginning to adopt the Western lifestyle. Our meals are beginning to have less fibers. We have a lot of quick fixes. We have a lot of snacks right now, ready-made snacks, more of canned foods that is being ingested. And even some of the, forgive me, the fast meals that we talk about, like noodles, for example. I mean, these are meals that are not well prepared. They're almost like something you do in 2-3 minutes. And this kind of diet is what we are beginning to ingest now. As at the days of our parents 40, 50 years ago, when there's a lot of fiber, there's a low fat, animal fats in their diets, So adaptation of the Western lifestyle is a major reason for us here in Black Africa why this thing is beginning to is getting more rampant. Other factors, yeah.
And it's quite deadly now, isn't it?
Yes,
and
yes.
Can you tell us, how this, for people who are listening, and obviously any men who are listening should be really listening hard, and for all women who have men in their lives, be they young or old, they need to, really take note. How can a person tell that they have colorectal cancer? What are the risk factors? What make people prone to it? And how can people pick it up if it's something that they think they should have, and how can they address it?
Okay. There are, as you said, there are risk factors, having to in detecting the causes of cancers. And I'll discuss it this way. There are the modifiable risk factors and the non-modifiable ones. The modifiable risk factors are behavioral risk factors that have to do with diet, risk factors that have to do with sedentary lifestyle, risk factors that have to do with smoking and alcohol consumption. These are risk factors that has to do with the behavior of the individual. I mentioned diet while we were discussing about low fiber diets and low and high animal fats. These are culprits, as risk factors. Sedentary lifestyle, and unfortunately now, where we have the white collar jobs, people get into their office, sit 6-7 hours without having to stand up from the desk. And the weekends, we rather just stay indoors. So the advocacy now is to have an active lifestyle. Do some exercise, 20-30 minutes a day, even if you have to just walk some distance, 1 or 2 kilometers in a safe environment, so that could help in prevention. Now, we have the non-modifiable factors that have to do with the genetic factors of colorectal cancers. 6% of colorectal cancers are passed down. 6% of all colorectal cancers are passed down from a father to a child or a mother to a child. And yes, I would not want to bore you, but there are identifiable syndromes that could predispose a person, to colorectal cancers. Now, talking about the clinical manifestation, when you begin to have some red flags in your bowel habit, when constipation is alternating with diarrhea, you should pay attention. When you begin to have blood in your stool, which is not a normal finding, you should pay attention. When you're losing weight for no identifiable cause, you should pay attention. Nausea, vomiting, abdominal distension, abdominal pains. We could be from an obstruction, Usually the left-sided cancers will present with some degree of abdominal distension from obstruction. Then the right side could present with other constitutional symptoms. But the thrust of our discussion would be in screening, medical screening, and when you do your yearly meds evaluation, and you can adequately screen and find out what's going on within your system.
Now, can you tell us a bit more about screening? Because obviously people are listening, and these are symptoms you've described people have, and they're going to start thinking, how can I screen myself? From what age should I screen myself? What methods should I go for? Because, there are different methods. Which one suits me best?
Okay, when I have an opportunity to be on air, I tell people that your birthday celebration should be for yourself first. So what I mean is, on your birthday, get to a hospital, get to see your GP, and let him run basic tests for you. Now, we're talking about blood work, full blood count, EUCR, LFTs, and there is a tumor marker, carcinoembryonic antigen, that is quite specific and sensitive to colorectal CAs, to colorectal cancers. So
that's
when
CEA.
Sorry?
Because when you said it's a bit long. CEA. Yeah?
CEA, yeah. CEA for short. Forgive me. CEA for short. It's a glycoprotein that seems to be increased in those who have the disease or are susceptible to the disease or are in the early stages of the disease. So, and other investigations you could do are the sigmoidoscopy. These are investigations that a flexible tube is passed through the anus and into the rectum, down or up, rather, into the colon, where they can look into the colon and see the passage of the colon and see if there are any abnormal growths or any abnormal findings in the colon. Now, when that is done, you could now take a sample if there's an abnormal growth that has been found. A pinch of that sample is taken and analyzed. So when you're having your birthday celebration or you're having an anniversary, these are the basic things that you can do for yourself as a man.
I must tell you, I have to confess, it does not sound like a celebration. Having is something. See, most people were with you up until taking a blood sample, but for your birthday to have a tube passed up your rectum, that just does not sound like anybody's favorite birthday celebration. So maybe they can do that the following day. I don't know. But anyway, I think what is important is what you're saying is that we have to look after ourselves. And the colonoscopy that you're talking about is a critical part of it. Now, sometimes some people say you should just do a simple blood test, the one blood in the stool, or the FIT test. What are those two tests, and what is the difference? And at what age should we start doing this? And what age do you need to do the actual colonoscopy? Is it something that needs to be done every year?
Now, well, I didn't quite finish the array of investigations you could run. There's the fecal occult blood, that you could run in any standard lab, right? And it gets to investigate if there are traces of blood in your stool. And there's the stool DNA that you could run also. The fecal occult blood you could run once a year. The stool DNA you could run every 3 years. And the colonoscopy is done every 10 years. From age of 40 to 50, you could start running a colonoscopy, and a sigmoidoscopy you could do every 5 years. Now, as to when you start running these investigations, it's not cast in stone. Now, when there's a family history, there's a first-degree relative who's had a colon cancer, then it's important that the children, the first-degree, the children of that client, of that patient, now begin to run these investigations. You could start as the fecal occult blood you can run at any age. I have a 15-year-old girl with colorectal cancer, and for her, I believe if we run a gene analysis, she could probably have a defective gene, that's carrying this disease, and she's inherited that gene because she's manifesting that very early. So we cannot put a cap as to how early you can start, because of, it varies for different people. So in as much as I can say that those who are high risk, when I use the word high risk now, you have a first degree relative who's suffered from disease, then you have a history. There's a high risk. Now, if you run a gene analysis, and some of these genes, abnormal genes, have been found within your family tree, you're at high risk. So you could start running the investigation. But for someone who is in the general public, now 80% of those who have colorectal CA don't have a family history, So you could do a yearly medical check, as we have said earlier. Then from the age of 40, 50, you could do a colonoscopy or a sigmoidoscopy every 10 or 5 years respectively, or you just run the fecal occult blood or the stool DNA, every year or every 3 years, as we have discussed.
Thank you, Mrs. Akintunde, for coming on the program to share your experience with us. Can you tell us, we know you have an NGO which you started. Can you tell us why you started this NGO specifically for colorectal cancer?
Oh, okay. Good morning, Dr. Ajayi, and thank you for having me on your program. Prior to 2013, I never knew about colorectal cancer. I've not heard about it before. Not until my husband was diagnosed of colorectal cancer in 2012. And he was they were treating him for typhoid and I think malaria and typhoid. Yes, malaria and typhoid. Then he wasn't getting better. Then before we know it, the stomach started swelling and they were asked to go for further tests. And when we went for that test, the result came out. And then first and foremost, we were surprised as at that time, MIR was expensive. I think we did it for about 250,000. We're like, what is wrong with him that we are doing a scan for that amount of money? And the result came out, and the doctor now told us that they were not even sure. They were thinking he had lymphoma. That's the cancer of the lymph nodes, and which was even new to me as well. But later they were able to have the accurate diagnosis, and we were told that it's colon cancer. And then they told us it's going to go for treatment, and I thought it was something easy. I never knew what was about to hit us then. Then they told us the treatment, first and foremost, for them to have to go for they have to do surgery. He has to go for surgery, and they did the surgery. After that, then they asked us to come back. That they have to go for further treatment, and that he has to take chemotherapy. I've never heard about chemotherapy before, and so I was like, oh, chemo, okay, fine. And they told us that it will take he has 6 sections to take, 6 courses also, and he took the chemotherapy, which was quite expensive as at that time. I think one section was about 360,000 then, and that was way too expensive for us as a couple. It took all the 6 courses, and lo and behold, this cancer came back, and we at that point I just gave up on the healthcare system in this country. That was how I didn't know much then, and I was like, I have to take him out, and so we're planning to take him to Germany. Germany didn't pull through, but we're talking to doctors in Germany, and then India came through, so we took him to India. Unfortunately, he passed on in India, and then when he passed on in India, I learned a lot of things: the healthcare system, the information communication, how they were able to relate with me. Nothing was hidden from me. When I took him to India, they did all what they need to do. They did all the screening, and they told me exactly what we are dealing with. They didn't withhold any information from me. They told me his disease is far gone. They told me he has few more weeks to live, which was tough for me. I was the only caregiver that followed him to India, and these are not information. As a Christian, in my country where I'm coming from, you don't tell somebody someone wants to die. This is somebody that I hold so dear to my heart. This is somebody that is somebody. He was my classmate in the university, and we've gone through a lot together. And you're not telling me he has 3 more weeks to live. As a Christian, I rejected it. I speak in tongue. I said, no, it's not his portion. He won't die. And unfortunately, I won't say fortunately, because his doctor wasn't even a Christian. He was I don't know, is this thing, all this, their religion, whether it's Hindu or so in India. And the man was telling me I should go and ask that my God, I shouldn't disturb him, because his condition kept on deteriorating, and I was asking questions. And they were talking to me, they were telling me, they were explaining to me how he was gradually slipping away. And I wasn't taking in those information, but I heard what they were telling me. But because as a Christian, I refused to take in all those things. And they kept telling me, they didn't give up. They kept at it. They were giving me all the information till he passed on in India. And I brought his corpse back to Lagos, and he was buried. When he was buried, after his burial, people will come and visit me, and they asked me, he was 39. He had that disease when he was 38. And they asked me, what was wrong with him? A brilliant man, handsome, cool. What happened? What actually happened? Within 1 year, we lost him. What happened to him? And I tell them that, see, this is what the doctor said. They said he had colon cancer. They were like, what is colon cancer? So I was not the only one. Majority, in fact, about 80%, or I don't want to exaggerate, but really about 90%, as at 2012, 2013, when I lost my husband, I'm not aware of colon cancer. So that tells me there's a vacuum to be filled. There's still very minimal awareness on colorectal cancer in Nigeria. And after the whole thing, I sat down in my pain. What do I do? People will come. I keep talking to them about colon cancer and all the information I got from his doctor in Germany, and what information I got from India. And then the books I started reading, how to take care of him, the food to give him, how to manage him, and all that. And so I was like, okay, the only thing I can do in this country. Then because I remember I Googled, I was looking for NGOs to talk to. Our doctors are overwhelmed. At Eco Hospital, then he took his chemo altering in the Eco Hospital. And about 1 doctors will attend to different cancer, breast cancer, lung cancer, cancer of the, all sorts of cancer, only 1 doctor. And there's so much in a hurry because there are other patients queuing. You can't be asking your doctor, what food do I give him? How do I do this? How do I do this? They too also get tired. And sometimes they don't even respond to you. And even the nurses too at a core hospital. So I get my information how to manage my husband as a caregiver from organization abroad. So what then I did after the whole episode, the passed on and everything, I was like, okay, what do? I need to start something on colon cancer in Nigeria. There's no colon cancer in Nigeria. There's no colon cancer, colorectal cancer NGO in Nigeria. And so for us to have a solid team, I had to look for someone who is a gastrointestinal doctor. Before then, I've never heard about gastrointestinal doctor or gastroenterologist. But because we want to have a solid foundation, we want a foundation that can address people, that will have people with competence and people who has knowledge on this disease. So I searched, then we met Dr. Adedapo, who came on board and was excited too. He's a passionate gastroenterologist and is in LUTH. So he's a co-founder of Niola Cancer Care Foundation. He came on board. We started the NGO in 2000, officially registered in 2016. And then we start the advocacy. Niola Cancer Care Foundation, just like what Dr. Ajay has said. Dr. Ajay, well done. You are all doing amazing work. Honestly, I must commend you. We thought about how do we communicate this message? From research, we realized that colon cancer is one of the cancers that you can actually survive if it is picked early. Unfortunately for my husband, the signs were there. But though the signs were late, because when we left Nigeria, they were telling us he was in stage 2, not knowing his disease as far gone, he was in stage 4. And then when we got to India, and we have to ask so many questions, and we realized even in Germany, they were telling us it was his lifestyle, his eating habits. And though he doesn't eat out, we cook at home. And then he doesn't smoke. But then they said, is our area polluted? Which it was. We're living in somewhere in Ilukpeju. Ilukpeju is more or less an industrial area. And where our house was then was a very high populated area with all sorts going on. And the signs were that actually that means what I now realized along the line was that if my husband has done some tests, like go for his FOBT, fecal occult blood test, FIT, fecal immunochemical test, or if he has done his colonoscopy, they would have picked all this thing because cancer is not sudden. Colorectal cancer is not sudden. It built up over the years. Started with a polyp in his colon before, because they have to lecture me. I also have to start doing research, going for seminars on colorectal cancer so that I will know more about this and see how we can also communicate to people, tell them that if you go for your screening is very important. Just like Dr. Ajay said, what do you want to give yourself? A special birthday. Have you taken care of yourself? Have you done your screening? Have you checked yourself? The only place we all know that the cancer cannot grow is on our hair. This is our hair or our enamel. But every part of our body is prone to cancer. So you need to start checking yourself, going for screening. And so we encourage people at the NGO, we talk to Nigerians, go for your screening. Fecal occult blood test is not really as expensive as that. We have Nigerians, we have women who wear wig of 80,000 naira. They buy ashwebi of 100 and something thousand. Some people buy ashwebi of 200,000. And you can, in fact, our colonoscopy screening in Nigeria is cheaper compared to developed countries, compared to US. Yes, it's cheaper. So why can't you go for your screening? The earlier you pick it. Fortunately, as we've said, colorectal cancer is one of the cancers that you can actually survive if it is picked early.
Thank you. Thank you so much. Unfortunately, time is fast spent and we've even almost exceeded the time. Can you, for people who are listening, who want to support the excellent advocacy work you're doing, can you just give them a phone number so that they can reach out to you?
Okay, our number is 080 333 4594. 080 330 4594. Our Twitter handle, Instagram handle, Facebook is at Niola Cancer Care Foundation. You can check us out on LinkedIn, Niola Cancer Care Foundation.
Thank you so much.
Thank you,
Dr.
Dr. Pamela.
Anje, I think really Mrs. Akintunde has said it all. But do you have any last words for our listeners, quickly?
I'll just reiterate what she said. I mean, life is for the living. Let's do everything we can to make sure that our numbers are within range. Let's do our checkups. Let's run the checkups. Our clothing, our makeups, our beauty tools are not as important as the body that will wear them, that will put them on. So let's take care of our bodies and we'll enjoy life. Thank you.
Thank you for watching. Please like, share and subscribe for new video updates.